In the financial year 2021 and 22, the money spent by Indian government on health expenditure was estimated to be nearly 9 lakh crore rupees. That is 3.8% of our total GDP, which also means 6,602 rupees was spent on each Indian. Let me break it down. As per National Health Policy Report, India has 41,245 government hospitals and 43,487 private hospitals. But do you know how much of a health budget is spent on government sector and how much on private sector? Before we know where the money is spent, we need to understand how the money is spent. The health budget is mainly spent in two forms: current health expenditure and capital expenditure. Current health expenditure also means recurring expenses, which includes inpatient care, diagnostic services, transportation and emergency services, pharmacies, salaries of health personnel, administrative services, etc. Whereas capital expenditure is mainly the money spent on infrastructure, the money spent on construction and maintenance, purchase of equipments, and investments in new facilities. As per National Health Policy data, out of the current health expenditure, government sector received 18% of the funds and the private sector received nearly 27% of the funds. Think of current health expenditure like a pyramid. 18% goes to government sector, 27 goes to private sector, the rest of the money goes to building and strengthening the entire health system. When it comes to utilization of these healthcare services, NSS report highlighted that people preferred private sector over public sector. 66% of the general health utilization and 55% of the hospitalization were happening in private sector. Forbes also reported that 1 in every 3 Indian preferred private healthcare over public healthcare. India still doesn't have an updated national data after 2018, but all evidence suggests that Indians overwhelmingly rely on the private sector for healthcare, even when the government care is free. More recent evidence from Ayushman Bharat also suggests that 50 to 65% of hospital care is happening in private hospitals, indicating continued preference for private care even among low income beneficiaries. Perceived quality of care, better accessibility, lesser waiting time were reported to be few of the many reasons for seeking private hospitals.